Good afternoon, everyone, and welcome. Manitoba Start is the leading provider of career services to newcomers in the province of Manitoba and connects businesses to a world-class workforce. I would like to welcome you all to this Spotlight webinar, a series of live broadcasted events designed to assist you in entering the Manitoba labor market. Manitoba Start acknowledges that we are gathered on Treaty 1 territory, the traditional lands of the Anishinaabe, Anishinaabeg, Dakota Oyate, Denisulini, and Hetawak nations, and the homeland of the Red River Métis. We acknowledge that our water is sourced from Shoal Lake 41st Nation. As a newcomer serving organization, we commit to learning about the histories, cultures, and the rights of the Indigenous communities to strive to build a respectful and supportive relationship for all. Today's webinar is focusing on the Occupational Health Centre, the workplace health and safety. My name is Luna. I'm the outreach coordinator here at Manitoba Start, and I will be your host for today's webinar. Given the large number of participants who are joining this webinar, we have muted your microphone to allow for better clarity and less interference, and your camera as well. So we will be going through a couple of housekeeping items before we begin. You can use the raise hand feature to indicate that you have a question or comment by the end of this session. And to do this, you can click on the participants button in the meeting controls, and you will find the raise hand icon next to your name and click on it. This will notify us that we have a raised hand. And then I'm gonna let you know that I have allowed your mic. That's when you will unmute yourself manually from your side and you can ask your question. Teams webinar provides a Q&A feature that allows attendees to ask questions as well, so specifically in the Q&A panel. And to access this, click on the More Options 3 dots button in the meeting controls and select Q&A, and then you can type your question there, or maybe you can use a chat as well. If you are using a mobile device, you can do the same. You can use the raise hand feature, Q&A, or the chat. Before I introduce you to our today's presenter, I would like to run a few polls just to get to know you more better. So I'm launching the first poll, and our first poll for today is asking, are you registered with Manitoba Start? So the polls will pop up in your screen. Just click on yes or no, and then click on submit. Valerie, yes, thank you. Thank you for being Manitoba Start client. I can see some replies on the chat. Thank you, everyone. Feel free to use the poll if you can see it in your screen as well. Thank you. Osad, I see you have raised your hand. If you do have a question or comment, you can type it on the chat or in the Q&A. Okay, I'm gonna close the polls now. We have 7 responses on the poll, and they are all registered with Manitoba Start. Thank you, everyone. The second poll asks us, do you need help with a resume, cover letter, or interview preparation? Again, you can select on yes or no and click on submit. I'll give you a moment to answer. Okay, we will now close the polls. And I will share the results with you. From the responses on the poll, we have 82% saying yes and 18% no. So we will be sharing more information on how Manitoba Start can help you with your employment and job searching by the end of the session. Now let's go to our third poll, and it's asking, where are you joining us from today? So your location, are you from northern Manitoba, southern Manitoba, Winnipeg, or outside of Canada? Okay, now we will be closing the poll. Okay, all our attendees are from Winnipeg. Thank you everyone and welcome to our today's session. Our final poll for today asks, what's your reason for attending this webinar? Are you an internationally educated professional, a settlement worker, a career coach, or other? Okay, now we will close the polls and I'll share the results with you. Here we have a mix of attendees. We have 20% internationally educated professionals. We have 18% settlement worker, 64% other. Thank you everyone for participating in the polls. Our today's webinar is with the Occupational Health Centre, Workplace Health and Safety. Starting a new job is an exciting experience, and workplace health and safety is an important issue for workers and employers. Workers have a right to safe and healthy work environment, while employers benefit from a healthier workforce. The Occupational Health Centre is a community health center under Winnipeg Regional Health Authority, specializing in workers' health. This center works with employees, employers, and a joint health and safety committee to improve workplace health and safety at workplace and eliminates hazards. Our today's session will cover rights of Manitoba workers on workplace health and safety, how to identify and report health and safety issues, injuries, and diseases at work, learn about the workers' compensation system, resources for workers related to safety and health in Manitoba, and we will have Q&A session with an Occupational Health Center representative as well. So please welcome Jacqueline and Shoei from Occupational Health Center, and I will pass it over to you, Jacqueline.
Okay, thank you so much, Luna. Hi, everyone. Good morning. Good afternoon, actually, from Winnipeg. My name is Jacqueline Obianuju. I am a registered nurse, and I'm also a I've been with OHC for, I would say, close to 9 years now. So it's been a journey. I have been training in the community regarding health and safety when it comes to workers' rights and what they need to know when they have a new job or when they're new in the community or they're new in Winnipeg. So today we are going to talk about workers' rights and workers' safety as well. Before we start, we've done the land acknowledgement, so we're going to start with Health Center for Workers. If you have any question before I start, just raise your hands, or you can put it in the chat, then we will look at that when we have our question and answer time. Health Center for Workers has been in Manitoba since 1983, and they have been serving workers, like people that are actually working in Manitoba, in terms of their safety, and they have been also um, providing services in the community as well. They are located at 167 Sherbrooke. I don't know if anyone has been to that area before, but in the building where they share with Clinic Medicare, and there is also organization called SEC, Sexual Education Resource Center. So this is where they're located in case if you ever wants to visit them or go into that office for more information, they will provide that for you. Can we go to the next slide, please? So for OHC, Occupational Health Center, what do they do? For most of us, we might not have that services back home when we are where we are coming from. So OHC provides services in different angles. They provide outreach and education. They provide health promotion. They provide community development, medical care, and also workplace services. So what that means basically is if you're wanting to, or something is coming. So if you're wanting to, for example, for what we are doing today, we are doing community development. So I'm a community trainer. So I'm giving you that information that you need to know regarding your rights, your safety, where to find help in times of injury at workplace. And also they provide services when it comes to Medicare, like if you are injured at work, you need a referral to go see a doctor. They will give you that referral. Also, when it comes to worker compassion board, if you are looking to appeal for your compassionate when it comes to injury at workplace, they will help you with that process as well. Which Occupational Health and Safety also they also do education around outreach and education, like I mentioned. So health promotion if they need injury prevention policy review at workplace, and also health safety committee. So this is also in your workplace when you have a job, when you get a job. They also promote people have that services like providing health and safety committee. So we encourage workers to join that committee, which you will find in your organization when you start working or if you already have an employment. And also they also promote agronomics. So we're looking at your safety, the tools you need, or the proper chair, for example, or the proper alignment or things you need to have a healthy work environment. So that's basically what OHC does. It's a center for workers. If you're employed in Manitoba, this is your right place to go in terms of injury, in terms of safety, if you want to know more about your health, if you're not sure what's going on at your workplace, if you need referrals, if you're injured. So it's a center for workers that need to know what's going on for them or their rights in workplace. Okay. So we can move on to next slide, please. Okay, so before we dive into this video, we will look at so the video is going to tell us about workplace safety rights and responsibility among new members, newcomers in Manitoba. The video will show you what you need to stay safe and why you need training when it comes to when you get a new employment. Most of our newcomers don't do that because they're excited because they have a job. They want to jump into they want to go into the work because they've been looking for a job for a while. So when they get into that job without getting a proper training, there's a possibility that they get hurt. So we'll watch the video and we'll discuss about the outcome of the video at the end of the video, okay?
You're muted, Jacqueline. You're muted.
Okay, yeah. All right. So let's talk about the video for 1 second. As we can see from the video, Clara wanted to, I believe she wanted to impress her supervisor by jumping into that offer that who wants to do the work because somebody called in sick, and she took it upon herself because she wants to look as the good one or person that knows the job, but without getting the proper training or without even knowing how to use that equipment. So here in Canada, here in Manitoba, it is important for you as a newcomer to know your right and responsibility. In any job you're doing, there is always training that has to come first before you start your actual shift. So there's no place in Manitoba, from my knowledge, that gives you job today and tell you to go into the field or go do the job without getting you trained. So it's important to know that when you start your first job, make sure that you know what are you supposed to do. Read your job description, know what you're supposed to do. If it's not clear to you, you have to ask, or they have to provide you with training for sure. Also know about the hazard is very important. We're going to talk about all that, but before any job being given to you, they need to provide you with the information that you need to know about this job. They need to provide you with the hazard information, and you also have to know your rights in terms of, is it safe for me to do this job? Am I going to be fired if I don't speak up? So these are the things we are talking about today, for you to know that you are now in a different country that works differently from where we are coming from. So with the video that we watched, perhaps she's afraid. She couldn't ask the supervisor, can I get the right gloves, or even like know how to use the machine to work, but she ended up not asking for help and she got hurt. So we will look into your responsibility as an employer, and we're also going to talk about all the rights you need to know when you have a job. When you get a new job, know that in Manitoba, where we are, you have rights, four rights. Four rights we're going to talk about today. Right to know about the job that you are being employed for. You have right to participate in that job, and you also have right to refuse that job if it feels unsafe to you. If they're not providing you with the right equipment or right tools that you need to do that job, you can refuse that job and you'll be protected at the same time. So we will look into these four rights. In Manitoba, workers have right to know about the hazard in the workplace. Very important. So hazard can come in so many ways. We're going to talk about it. Employers are required by law to inform and train workers. So this is not just like, again, where we are coming from, you just get a job and you are doing the job right away. They need to train you properly. And I tell people what I know now for the last 10 years living in Manitoba. If I don't feel, even if you offered me a training for 2, 3, let's say 5 days training or 1 week training, if I don't feel right, if I don't feel ready, if I feel like I need more training, I will ask for more training, because once I have that job, once I do that job, I am solely responsible for it. So don't be afraid to ask for more training if you don't understand. It's 100% possible not to understand anything at the first start of your job. And workers has also right to know about the hazard of their jobs and how to work safely around this hazard. So we're going to talk about those hazards at workplace. So when we look at the hazard, what is hazard? Because sometimes we don't, like, we thought hazard it could be something as simple as maybe equipment falling under your head or something like that. But look at what hazard means. A hazard is any source of potential harm or damage within a workplace, within your environment. It could cause you an injury, it could cause you a serious illness or even a damage. So when we look at hazard, we have 5 different types of hazard. We have physical one. So when we look at the physical hazard, it's your environment. It could be the type of workspace or workstation they provided for you. It could also be like, when you talk about environmental, you're talking about we are in Manitoba. We are also living in Canada, where we know that it's so cold. So when you have a job, it is a job, for example, this is an example I'm providing. Your workplace has to make sure that when it snow, they need to clear off. It's not your job to clear the driveway if it's not written in your job description, but they should be able to clear the snow so that when you come to that job where you're supposed to start your shift, you are not, because again, snow melting or snow on the floor can make you, like, it can slip you off and you fall, right? That's an hazard. So they have to provide a very healthy environment for you. That's a typical example of environmental. It could also be in the space where you're doing the job. The equipment is not functioning. It could be the space is not conducive. It could also be, for example, it's too cold in the workplace, and they know they need to provide you with an AC, with a heater, for example. Now that we're in summer, they should turn off their heaters, and they should also put in the fan or AC. So these are what can also lead to potential illness, because when you, for example, in cold season, they need to provide you with heater to keep you warm. So it's also an hazard in environment. When we talk about the chemical, which we're going to look at it later, it also has to do with all kinds of chemical at the workplace, biological hazard. There is also work design hazard, ergonomic, stress, and psychological hazard. So we're looking at all these hazards. These are what can cause you injury, illness, damage without knowing. And so, guys, every workplace has a potential hazard. Every workplace has a hazard. So firstly, let's look at the chemical part of the hazard. So when you have a job, when you've been offered a job and they gave you a job, and maybe your job is cleaning, for example, and they provide you with all kinds of chemicals, read the label. Always read the labels of what you've been offered to do. They will offer you things. This is what you need to do the job. Chemicals, for example, there's always a label on every product. Always make sure that, and again, some companies, organization will provide you with a training called WIMIS. So WIMIS is also for, these are all coming out in WIMIS: health hazard, flame, what to do when you encounter any fluid or any hazard or any chemicals. How do you protect yourself? There's some hazard that you have to wear gloves and you have to wear a face mask to protect you from inhaling them. So if you don't know these things and you go on and touch those chemicals, it might end up causing you cancer. It might end up causing you health issues. So these are the important reasons why your workplace needs to provide you with label containers, information and they need to educate you on all the chemicals labeling for you to know that this is not healthy for you. You don't have to inhale this. You have to wear a double gloves if you have to, or you don't have to wear. So they need to provide you with all of this information when it comes to chemical hazard. So can we move on to the next? So yeah, so now we talk, remember we have four rights. So the second one we are looking at is right to participate. So right to participate in a workplace too. You have right to participate in every organization. There is always a 20 employees in a health and safety community. Every organization, maybe there's a 50 people in that organization, it's mandatory for them to form a committee, which is called Health and Safety Committee. So we encourage newcomers to, join that committee when you start a job. Always ask those questions. When you get a job and they explain everything to you, if they don't mention it to you, ask them, do you guys have health and safety committee? Because if you join the committee, this is where your voice can be heard. For example, if there's something that is not right at the workplace or it is not healthy for other work, not so, because you're also advocating for yourself and for other newcomers that can't speak up for themselves. So when you participate in this health and safety committee in your workplace, you can be that voice they're looking for, to speak up, to bring it to the committee. So the committee will be the one to do to report that any information that you gave them regarding unsafe workplace. something that is not right that needs to be fixed, or if you see a leaking roof, for example, or something, a boot is not, a colleague is working with no training, or they don't even know what they're doing, but they have to do it because they need to get paid. You have to stand up and speak for them. So that's what health and safety committee does. I will encourage you guys, when you get a job or when you start working, please ask for this committee. It's your right to participate, and it's also part of how you speak up, to also, keep everyone safe, especially when you're a newcomer in the country. So right to participate is highly encouraged. I encourage you to join when you get a job and speak up when you can. So let's go to the next right. So we also have right to refuse. Right to refuse, basically you're looking at when you have a job, or they offer you a job that is not safe. Like I mentioned, it could be they're making you maybe lift something heavier, and maybe a huge equipment, for example. Most of the equipment, they will tell you in your work, always read your job description, always read your contract when you get a job, because in that contract, they will tell you, if you get a job, they can tell you what you can lift, maybe 10 kg, 15 kg maximum. They will state it. And if, say, you get this job and they started telling you to lift 50 pounds or maybe 100 pounds with no support equipment to lift those heavy loads, this is where you come in to refuse that. Say, hey, this is not on my job description. I was told I can lift 30 pounds or 10 pounds, but this is 50. And because again, you're straining your back. When you lift those heavy things without any proper support, it will end up giving you an injury. So this is where we come in to tell newcomers, you can refuse that job on a basis that you know that it's not safe for you. So what do you do when you have such experience? You have to tell your supervisor. That would be your first thing to do. Let your supervisor know that, hey, I've been offered a job, I've been offered to do this, I will leave, do this work, but I don't think I can do it, because it's not on my job description, and secondly, it's not safe for me, because safety comes first, right? So tell your supervisor, you report it to your health and safety community. That's what we say. Try and join that committee, because that's where your voice will be mattered. You can also steps you can do after reporting to your health and safety committee. You can inform workplace safety and healthy branch, that's the OHC. Then the report and final decision will be, of course, there will be an investigation, right? So it's important to follow these steps. Tell your supervisor, always tell your supervisor, always go to your boss and report any incident, anything that doesn't feel safe, and go to your health and safety committee, report that, and then go to OHC, any branch, then they will do the final report and final decision. And so you won't be fired. There is no, oh, if I refuse this job, they will fire me. They don't do that. Nobody fires you on a ground that you are seeking for your safety. They don't do that. And if they fire you, believe me, there's also steps for them to there's the legal steps, right? So it's not like I'll lose my job if I speak up. No, speak up, because you are being backed up by the it's a law, right? So always speak up and always refuse a job that feels unsafe. So let's go into right to protection. Workers cannot be penalized. That's what I just said. You cannot be penalized in any way for exercising your rights. Thankfully, in Manitoba, there's a law. There's also a guide for us. So because we are always afraid to speak up, we will end up saying, oh, if I speak up, I'll be fired. So there's always a law that protects you. So you'll be protected. And if they fired you, again, remember you have OHC, and they're also there to guide you in every steps. They're there for workers. So will get to that point to see what you will do when you get to the point where you are being fired. How do you get paid? Because you're worried about, oh, if they fire me, I'm not gonna get paid. If they fire you because you exercise your rights, yeah, you get paid. They will be fine. They will be fined, and you get paid for that process, as long as you are exercising your rights and you're doing the right thing. Okay, so we'll move on to the next slide. Okay, so question to discuss. What makes it difficult for newcomer workers to use their health and safety rights in the workplace? What do you guys think that makes it difficult for newcomers? You can put it on the chat, just to know that we are all on the same boat. What do you think that makes newcomers to not exercise their rights when they get a job? Um, yeah, if you can put that on a chat for us to see your thoughts. Just give us like 1 minute to think of what makes it difficult for newcomers. What do you guys think? Okay, let's see what people are saying. Communication, right? Yes, I agree. Communication, lack of communication, maybe someone is super afraid to talk, or maybe they will say, oh, language, they can't hear me. I have an accent. They can't, if I speak, they will ask me, pardon, what did you say? Repeat yourself. I mean, you're communicating, it's English, right? And don't forget, they will always ask, even if you're here 20 years, as long as you're an immigrant and you have an accent, yes, you will definitely be thrown to that conversation of, oh, you have an accent. Yes, we do have an accent. We weren't born here, but that doesn't take the fact that you can't exercise your rights. So communication, somebody mentioned language barrier. Yes, that would be a barrier. Looking for first opportunity. You don't want to get fired because, oh, if I talk, they will tell me, they will lay me off. Yes, back home they will do that. But here in Canada, they don't. They can't just lay you off just because you say something about, oh, this is unhealthy. They will even welcome you because they know that you know you're right. But if you don't speak up, nobody will, do nothing, right? So always speak up. Okay, so let's go to the next slide. Okay, another question says, what makes it difficult for newcomer? Oh, we're done with that. Okay. Oh, yeah. So sorry, can you take us back to that question one more time? Yeah, so this is like some of our participants mentioned today. The answers we have will be they don't know their rights, it's a language barriers and communication issues, of course. It's difficult finding employment, like we said, and fear of losing that job. So that would be the reason why newcomers don't speak up. Okay. We can go to the next slide. Okay, so let's look at workplace health and safety resources. For these resources, we're looking at number one question. I have a health problem. So we're looking at where can you find information? Where can you find what you need? Because here in Manitoba or here in Canada, they are huge on resources. You need to find the resources that you need to thrive in this land. So if you have a health problem, I have a health problem, I think my job must have cost me. This is caused by my job. Where can I go for help? Do you know what to do if I have a health problem and it's caused by my job? Where do you guys think you can go for help? You can put it on the chat. I would like to see your thoughts. Because it will happen, right? It could be a fall at workplace, a cut, all of that. Where do you think you can go if you have a problem caused by my job, not at home, at your job? Where will you go for help? Do we know where we can go for help? Okay, so just for time's sake, can we go to the next slide? So you can call Occupational Health Centre. This is where you go for help. Remember, OHC is they are here for workers only, like injury at work. Like you all have family doctor, I believe so, or you have a doctor. So when you are healed or your child or family is not feeling well, you take them to your family doctor. So in this scenario, if you got injured at workplace, please call OHC. They are health center for us, for we workers. this is where you go for help. So a community health focus on workers' health, right? Workers' health. You can see a doctor. They have a doctor in that organization, in that clinic. They also have counseling for newcomers. They have education like what we're doing today. It's also from OHC. There's also a short-term counseling for newcomers with health concern related to that. So don't bring your personal health into them. Just bring work related. If you think your job causes you a problem, if you want to put down the number, then write it down, or you can take the website to click on check them out. It's where you go for any work related injury. Okay, OHC is there for workers here in Manitoba. Okay. And also, yeah, this is their website for any complaint to confidence, preparing Manitoba workplace for psychosocial safety. So they have all kinds, injury support, health and safety. If you're not sure of anything, if something is going on in your workplace that you feel like you need to talk to somebody, you can call them. Yeah, if you're not comfortable with your workplace, you can call them. So question number 2, I was asked to do a job and I believe it's unsafe. I want to exercise my right to refuse. Where can I go for help? Remember, we talked about this. I was asked to do a job. If you know the answer, go ahead and put it on this chat as well. I was asked to do a job. I believe it's unsafe, and I want to exercise my right to refuse. Where can I go for help? You go for your help. That's right. Supervisor, of course, we mentioned those steps you have to take. Always make sure that you tell your supervisor first, so that because they need to know before you jump, to the next step. Remember, you also have a committee, your health and safety committee at your workplace. You can report to them, and from there you can take it to OHC, and there will definitely be they will do their, of course, they will try to make sure that they do a lot of checks to make sure that what you're saying is right? So make sure you have your evidence, because in this country is barely sold on evidence. Everything is evidence proof. Don't come up with something that you're not sure. Make sure you have an evidence before you go to your supervisor. Okay, so let's move to question. Okay, so again, this is it. Workplace Safety and Health Branch, Government of Manitoba. There will always be an inspection and investigation of workplace. Like I said, have an evidence. Make sure that they told you, oh, they asked you to do something extra out of your work description, and maybe they told you to lift a heavy, massive thing, or they didn't provide you the right shoe, or they didn't provide you the right equipment. Yes, please call workplace safety and health branch. Tell your supervisor for sure. If they're not listening to you, if they're like, oh, please go do the job, we don't have anything, no, do not do that. As long as you know that is not safe. If your supervisor is not listening to you, your workplace safety committee, they're not listening to you, yes, your next step will be to call this number on the screen and make your complaint. Of course, they will do the inspection and investigation of that workplace before they will let you. But again, you won't be fired for sure for exercising your rights. Okay. Question number 3. I was injured at my work. Now I can't work, but I still need money. Where can I go for help? We haven't discussed this yet, which is another in the next slide. But I will tell you, when you get injured at workplace and you can't work and you still need money, of course you would get paid. Some of the time is not from your workplace, but there's an organization called WCB, Workers' Compensation Board, will pay you, and also EI. We will talk about that to the next slide. Okay, let's go to the next slide. Okay, here is how to put up a claim when you get injured. How do you get paid? So this is the step you have to follow. Let's watch the video. Yeah. So this is where you go when you have workplace injury and you can no longer go to work. It could be lengthy, depending on what it is that caused the injury. Sometimes I've seen some of my colleagues we take off like 5 weeks, months. It depends how you heal, right? Or what was like initial cause of this injury. But so you know, when you're out of work for a couple of weeks or months, you are entitled for your monthly or bi-weekly wages. You won't be out of money, but it's a lengthy process. They will cover everything for you, even when you medical medication, and also even if your injury requires you to go see a physiotherapy, yes, they will cover that for you as well. But at the same time, while you are doing that and you are also waiting to hear back from them, there is also what we call EI. So EI will also recovering part of, because when you get paid, when you have a job and there's, if you look at your pay stub, there's some money that goes to employment insurance. So they will also take out. So this is when it comes when you lose a job out of because of injury, EI will be paying you until WCB will come into and start paying you. So what I'm trying to say is you when you injured at work, take your time. Take your time to heal. Take your time to recover. Take your time, not just physical, mentally. Take your time to get back to yourself and go back to that job. As long as you have the right information, you are reporting it, you make the claim and they are processing it, and they will pay you your money until you get fully recovered. And while you are in that process, always remember to give an update of how you're feeling to your supervisor, to your to the workers advisory that is helping you to your, they call it adjudicator. So they will help you when you get to that stage. They will be calling you maybe every 2 weeks to check on you how you're feeling. So but if you have all these services available for you, if you have been injured at work, you can get paid. Okay. So also if you're needing services to fill out the form, this is also where you can number you can call. It's called Worker Advisor Office. They provide free service to assist workers in dealing with worker compassionate. But so sometimes their forms are very lengthy. You might even get confused. But they will definitely provide you with the service. They will also provide you with filling out the form, assisting you, and also representing you. Sometimes people don't follow through because of also language. People don't follow through because they feel like they can't understand me. Please don't shy away from your right and responsibility in Manitoba. Always know that you have a support, you have people that want to work for you and work with you. Call the number. Like when you get to that stage, always know that there's a worker advisory office that will help you to go through that process, filling the form, assisting you, and representing you as well, so you can fully get paid. Okay, so let's go to the next slide. And also workplace healthy and safety resources. So these are all the resources that we have in Manitoba when it comes to what you need to stay healthy and safe at workplace. There's Manitoba Workplace Safety and Healthy Branch, Human Resources Canada. These are all resources that you need to know. Workers' compensation, they are the one that pays you money when you get injured at work. Workers' advisory office, they are the one that will help you fill your paperwork, advise to represent you, assist you with anything that has to do with workers' compensation board. And there's also Community Unemployed Help Center, Family Doctor Finder Program. If you don't have one, you can, call them. Then there's Occupational Health Center as well, which where we are today. So you need these resources to thrive in Manitoba. You need them to thrive in workplace, and you need them to know your rights as a worker in Manitoba. Okay, let's go to the next slide before we can take questions. Okay, so questions and answers. I think this is where we are. A community trainer, occupational health center, cross. Okay, so do you guys? I think can you go to the next slide? Let's see what we have there. I think that should be the last slide. Can you take me to the? Yeah, so that will be the end of the presentation. But before we say thank you, do you guys have questions for me or occupational health center or Luna? feel free to put in the chat. You can unmute yourself and ask questions.
Yeah, thank you so much, Jacqueline, for that insightful presentation. That was really good. We will open it up to a couple of questions, seeing we have a couple of minutes. So we
Okay.
have a couple of them here in the chat. Are workers treated in Manitoba without insurance? Is the first question.
I'm trying to see the question. Come on.
It's on the
Okay,
chat.
on the chat. Where is it? It's workers treated. I'm just, oh, here. Employment, will you be contact? I saw, how about an employment bridging is that the question?
I guess that Shoei has answered to
So
that.
are workers treated in Manitoba without insurance? Are workers treated in Manitoba without insurance? Of course, you have to have a job to have an insurance, right? So you have a job first. So if you have a job, you are being covered. So you remember, when you have a job, your job, you pay a lot of insurance when you got a job with, even with the government. So you are being covered. So so it's like another way around. Yes, you need a job to be insured. But if you don't have a job, you don't have insurance, right? So yeah, our workers treated in America without insurance. If you are a worker, you are automatically you'll be treated for sure because you paid insurance. Did that answer your question? How can we get this? The OHC would tell us if they can share that, or Luna, we can let you know
Yeah,
how you get
Shoei
that.
has said like she will provide me the PDF file and I'm gonna share with everyone who attended the session today.
Yes. So how can OHC can provide? Yeah, that's what been applied. Any other question that we are missing? Almost all the workers are covered by WCB. Yes, like I said, you have to have a job to be covered, right? But if you don't have a job, you don't have insurance. Basically, that's, yeah. So get a job and you are fully covered. Will you be contacting employment standard for further assistance? Oh, you will be. Oh, how about the employment bridging contract? Okay, okay. So it's been answered already. I don't know if you need a clarification on that. Okay.
Jacqueline, if you can see the last one from Christopher.
Christopher says, yes, ma, it's my question. Financial abuse and job roles didn't follow about employment contracts. No, the financial abuse and job roles didn't. Okay, I mean, I don't know where you work, but every job, like Luna can also, I'm sure we are working, so they will give you job description in your, even when they put the application out there to advertise for that job, there's already what, like, responsibilities. So even when you get the contract being signed, there's also employment role that you have, that you're responsibility for that job. So but the financial abuse you mentioned and job that didn't follow about employment, I don't know what you mean by financial abuse. I haven't experienced that, except you are talking about giving you more work out of your job description. That's what they're talking about, knowing your rights, right? So financial abuse, I don't think it's happening here. I don't know, anybody can speak on that, but I haven't experienced financial abuse. But I would tell you, I haven't also, the job I do, I'm a nurse. So I stayed on my job description. I can't do doctor's job, for example, and I can't do other people's jobs. So I stayed on my role. So that's because I know my rights. So yeah. Um, what else do we have? Did anybody has experienced financial abuse? Just to clarify that particular questions. I don't think so. Luna, have you guys heard about that financial abuse piece? I don't think I have.
Maybe Shoei has written something in there. Again, you will be contacting employment standard for
Okay.
further assistance regarding
Yeah.
contract issue. We do
Yeah.
also have employment uh, standard with Safe Workers of Tomorrow. If you want to join that, go check our event calendar and then you can register yourself. We do have this event for July.
Oh, that's
Yes.
good.
So you
More
can register
information.
and get more information. Yes.
More information, good for you as a newcomer. So nobody will, like you said, financial abuse. I see what you mean. Also, like thinking out of other perspective of it. It could also be like, maybe working longer hours, or it could also be like taking advantage of your hours because every hour is money, right? So it could also be financial abuse in that aspect. So always stick on. If you are doing 8 hours, do that 8 hours and go home. Except you're working overtime and you have to get paid for the overtime. But if you are just being, stay 2 hours after your 8 hours job and you're not paying, that is an abuse. Yeah. So don't do that.
Okay,
Okay.
perfect.
Yeah.
Thank you so much, Jacqueline, for
Yeah.
joining us today. And thank you all to the participants for your excellent questions. That was very engaging session. Again, thank you for choosing Manitoba Start because our services are free and funded by the Immigration Refugee Citizenship Canada IRCC in the province of Manitoba. Your feedback plays an important role in helping us improve and continue to provide high quality service. So we do have a 3 minute survey, I'd say, help us understand your experience and ensure we're meeting your needs and the needs of newcomers. So your responses are confidential and will be only reported in aggregate without identifying you in any way. I would appreciate if you can complete the survey through the QR code that you can see on the screen, or maybe I can share the link as well. Thank you, everyone. Thank you so much.
Thank you.
And today's event type is information session. So you can put information session on the survey as well. Thank you, Martin. So, if you are not currently a Manitoba Star client, you can call our front desk. You have the phone number here, or maybe visit our website. We do have a newcomers button where you can register for our services. By registering with Manitoba Start, you will connect with settlement services and have access to career services that can assist you with your resume development, career planning, job search strategies, and interview skills. For a list of programs and services offered by Career Services, go under Career Services tab on our website and you will find all the services on our um, Career Services. And we do have FCR in our website as well, where you can get resources for those of you who are internationally educated professionals looking to have your licenses here in Manitoba. And for all our events, you can check our event calendar as well to just stay updated. If you miss any of our events or maybe webinars, we do have a webinar recording in our website where you can check it, and you'll stay updated by following us as well. So you feel free to connect with us on social media. We're active on Instagram, Facebook, and LinkedIn. So on behalf of Jacqueline from Occupational Health Centre and the Manitoba Start team, thank you everyone for attending and stay well.
Thank you,
Thank you.
everyone. Beautiful day.
Thank you. Bye bye.
Bye bye.